He started out by glad-handing a group of city doctors, then with no shortage of hyperbole, announced what he called the largest, most comprehensive plan to have the city foot the bill for health care for all.
No one should have to live in fear. No one should go without the health care they need. Health care is a human right. In this city, we're going to make that a reality.
The mayor said his goal was to get the 600,000 New Yorkers without health care, about half undocumented immigrants, to accept his lifeline, to connect them with a primary care doctor and access to specialty care, prescription drugs, and mental health services. The city's estimated price tag, $100 million, based on the belief that it will be cheaper to have the uninsured go to city-sponsored clinics and urgent care facilities rather than the emergency room where they go now. Are there any estimates to how much you'll actually save by having people have primary care physicians as opposed to going to the ER where it's exponentially more expensive?
Absolutely, Marcia. So again, we'll get people some of the breakouts later in the day. There is a lot of money right now in our health system that can be used a lot better.
And just as the $100 million price tag may be a guesstimate, so is the price tag people will pay to connect to the NYC Care program.
For those who can afford something, they'll pay on a sliding scale. For those who can't afford anything, care will be for free.
David Sandman of the New York State Health Foundation, a nonprofit, praises the mayor's efforts, but he says there are still many unanswered questions.
Who's going to be eligible? You know, how are they going to sort out the moving parts of insurance versus care? You know, how is this a little bit different from the systems that we already have in place?
Staten Island Assemblywoman Nicole Maliotakis, who ran against de Blasio when he ran for re-election, says she's concerned that hardworking middle-class homeowners will bear a heavier tax burden to pay for the program. She also questions the mayor's ability to manage such a complicated program.
This is de Blasio Care, and we know anything about Bill de Blasio over the last 5 years is that he doesn't know how to run anything. Whenever the mayor takes over anything, it becomes a disaster. And all you need to look at is the homeless crisis, the subway crisis, overcrowded schools.
Well, another thing to work out is exactly how long people will have to wait for an appointment. The head of the Health and Hospitals Corporation says it will take a week or two to connect to a primary care doctor, a day or two once the relationship is established. The program starts in the Bronx this summer and hits all 5 boroughs by 2021. Maurice, Mary.
I think it's easier just to go to the ER.
A lot of people are going to say it's going to be a lot easier to go to the ER because you're going to get immediate help. Right. So I don't know how it's going to work out.